The Myth-Informed team became aware of an interesting incident relating to our home state. The Communist Party of China has asked the Wisconsin State Senate to pass a resolution praising China for its impeccable performance in fighting coronavirus. Melanie Conklin of the Wisconsin Examiner first reporting. This was also picked up by the National Review. So, the state Senate president, Roger Roth, Republican, Appleton, received an email from Chinese officials asking him to support and pass a resolution. They included the draft, of which they created and handcrafted. After being quite irked by the request after reading it, a couple of days later, Roger Roth said, quote, "We are going to introduce a resolution. It's just not one that the Chinese government wants." So, let's see what Roth was asked to pass by CCP officials. And that's CCP, Chinese Communist Party. As I read it, I'll add my own commentary, and the raw document is in the description. So here's the CCP version. Resolution proposed by Wu Ting. Wu is responsible for, quote, China-Wisconsin relations. And she asks Roth to consider, quote, adopting a resolution expressing solidarity with the Chinese people in fighting coronavirus. So here's what they say. Expressing the sense of the Wisconsin State Senate that the state of Wisconsin will continue to support China in its effort to stop the spread of coronavirus. Whereas the outbreak of coronavirus, known as COVID-19, first detected in Wuhan of Hubei province, China, and was reported by China to the WHO, or World Health Organization, on December 31st, 2019. Now, this is a true but misleading statement. It's clear that the CCP was aware of the danger of COVID-19 much earlier in this, but we'll get to more on that later. And we'll continue on with their proposed resolution. Whereas China's action has been critical to the global fight against the epidemic, and China has adopted unprecedented and rigorous measures for disease control and prevention, including locking down Wuhan, a metropolis of 11 million people, house-to-house temperature checks, postponing the return to work after the Lunar New Year break, construction of hospitals of more than 2,000 beds on green fields within days, bringing medical teams from across the country to Hubei province. These measures have been effective in curbing the virus from spreading to other parts of China and the world. Now, I hate to point this out, but we are in the middle of a global pandemic. But continuing. As a result, the daily number of newly confirmed cases in China has dropped sharply to double digits. Also, over 60,000 at this moment, people have been cured and discharged from the hospital, and the case fatality rate has remained lower than SARS, Ebola, and MERS. Whereas China has been transparent and quick in sharing key information of the virus with the WHO and the international community, thus creating a window of opportunity for other countries to make a timely response. Okay, I'm going to say that again. Whereas China has been transparent and quick in sharing key information of the virus to the international community, giving us all a window and buying us extra time. Okay, this is false on its face. And let's get into why and how we can prove that this isn't the case. While it's true that they do report the existence to the WHO on December 31st, they don't admit that it has human-to-human transmissible contact until January 19th, 2020. And there's considerable evidence, and we'll see, that they were aware of this. So an excellent information-packed, well-cited review of this timeline has been made available by independent journalist Jennifer Zeng. I really commend her efforts, and I really recommend reading this. It's packed. So the best information we have available, the first confirmed case of coronavirus is on November 17th of last year, of 2019. This was reported by the South China Morning Post. But to be fair, they probably hadn't realized fully what they were dealing with at this early stage. So it's not a smoking gun. And let's continue along the timeline. So according to a study in The Lancet, Quote, the symptom onset date of the first patient was identified December 1st, 2019, and that's in the graphs in the Lancet article. The patient had a history of exposure to Hunan or South China seafood market was identified as a possible point of origin of the pandemic. But also in this study, they document the first fatal case, who had continuous exposure to the market and was admitted to the hospital after a 7-day history of fever, cough, and dyspnea. That's labored breathing. 5 days after after illness onset, his wife, a 53-year-old woman who had no known history of exposure to the market, also presented with pneumonia and was hospitalized in the isolation ward. So it appears as early as the second week of December, Wuhan doctors were finding cases that indicated that this virus was spreading from one human to another. But there's more. According to Dr. Liv Zihong, the director of Digestive System Diseases, Department Number 5 Hospital in Wuhan, medical staff in hospitals in Wuhan are suspected of contracting viral pneumonia and are quarantined. So this is strong evidence of human-to-human transmission when healthcare workers treating patients are becoming sick. On December 24th, according to Chinese media, Caixin, Professor Zhao Su, the chief physician of the Department of Respiratory Medicine at Wuhan Central Hospital, sent a sample from one of his patients to a third-party testing agency called Weiyuan Gene Technology Company in the city of Guangzhou to conduct a gene test. On December 26th, according to Zeng Zhijian, director of the Department of Respiratory Critical Care Medicine in Hubei province, on that single day alone, she herself saw 4 patients with, quote, pneumonia of an unknown cause all in a row. On December 27th, the Weiyuan Gene Technologies result came back. They notified the hospital over the phone that it was a novel coronavirus. Zhao Shu said at that stage the patient had already been transferred to Wuhan Tongji Hospital. The result of the test was later published in the English version of the Chinese Journal of Medical Sciences on January 27th with the title of Identifying a Novel Coronavirus Case Causes Severe Pneumonia in Humans, a Descriptive Study. Another source, published by WeChat account named Winjor on January 28th. Now, he discussed the same article, but this author says that he worked in the private enterprise lab located in Guangzhou and received Dr. Shu's sample. So on December 27th, their laboratory assembled nearly complete viral genome for the viral genome sequence. The data was also shared with the state-affiliated Institute of Pathogens, Chinese Academy of Medical Sciences. So Winjor's article said, it can basically be confirmed that this patient's sample does indeed contain a new coronavirus, similar to a bat SARS-like coronavirus. The information obtained at the time was that this patient had been returned to his hometown. We cannot rule out the possibility of his contact with bats. They immediately realized the severity of the information and all of its potential risks. So they undertook preventative measures. Laboratory was completely cleaned, disinfected, the samples were destroyed. Also, the relevant personnel conducting the experiment were put under observational monitoring. Based on the story, it's evident that this particular lab realized the danger. And this prompted the CEO of the lab, to make an urgent telephone call to the hospital after the results were in. He also phoned the Wuhan CDC on the following day. He then traveled in person to Wuhan on December 29th and December 30th to communicate face-to-face with the hospital and the Wuhan CDC and shared with them all of the results in all of their analysis. In his article, Winjor stated that he was frightened when the results came back with a pathogen very similar to bat-like SARS. He predicted a grave public health problem. He said when he realized that they had found a new virus, he was both nervous but also excited. Nervous because this could be the next SARS, but excited because he felt like they caught it early, the patients were isolated, and he thought it could be possible to eliminate the virus before it really spreads widely. Instead, he ends up being extremely upset, disillusioned, and bitter because they'd worked so hard to identify the new virus. But when the official report, edited by the CCP contained the falsehood that no human-to-human transmission was found. The failure, he said, wasn't one of science or medicine or even a lack of technology, but rather the fault lies with the decision of the government as well as false media reports. So transparency? They're doctors, technicians. It sequenced the virus. There's overwhelming evidence that human-human transmission is occurring at least at the second week of December. And the CCP did not admit to the WHO that human-to-human transmission was occurring until January 19th, 2020. This doesn't sound like quick moving or transparency. Critical weeks, maybe months, lost and wasted. Back to the proposed resolution. Whereas the state and local public health authorities are closely monitoring the outbreak of COVID-19 and the risk of this novel coronavirus to the public, and the U.S. remains low, there is no need to overreact. Okay, what? Like, if the risk is so low, why the hell did you do a total lockdown of Wuhan, a metropolis of 11 million people? Why was it necessary to construct a hospital of 2,000 beds on green fields within days? The CCP says, what, there's nothing to see here? I mean, just so you know, Wu-Ting, Wisconsin's governor has issued a safer-at-home order and directed all non-essential businesses to close. I mean, the risk will indeed be low to most of us Scotties, but that's because of our own efforts, and it becomes at a massive expense. We currently have over 104,000 new unemployment filings this week, and this is compared to 5,000 from last year. So, yeah, Wu-Ting suggests don't get your panties in a wad as your livelihood vanishes overnight. And thanks for the advice. Most importantly, okay, this is back to the resolution. Most importantly, the novel coronavirus is a threat to all human beings, not just the people in the regions where the virus broke out. It shall not become an excuse for discrimination against epidemic-struck regions and people from Asian communities in the state of Wisconsin. Whereas ending the spread of the virus is in the best interest of the people at home in the U.S., and our cities and communities have acted to provide assistance to China. Okay, so we know that ending the spread of this is a big deal, right? If you turned on the news lately, it's pretty much all people talk about these days. I mean, you want us to publicly state that our cities have helped China. Now, I think you're doing the propaganda bit wrong. You should state how China stands ready to help Wisconsin. I mean, because it's clear that you guys are the experts at preventing and mitigating pandemics. Not how we can help you. And it's also helpful not to mix up your narratives. Recall that your state media is stating that you have extremely few new cases, so it wouldn't be you guys that would be needing the help right now. It might be us, since we're in a state of lockdown. So yeah, fixate on the propaganda could help us. So that's just my advice. But now, therefore, back to the resolution. It be resolved by the Wisconsin State Senate, that is the sense of the Wisconsin State Senate, the state of Wisconsin stands in solidarity with the people of China who are hard hit by the novel coronavirus, and that the state of Wisconsin will continue to support China in its efforts to stop the spread of the epidemic. Okay, this proposed resolution, how ballsy is it to claim world leadership on this pandemic when there's so much evidence that your government has been so self-interested and more concerned with its reputation than combating the virus? I mean, combating bad press and combating the virus are two totally different things. And to the other point, we are in solidarity with the Chinese people, just not the Chinese government. In fact, we're in so much solidarity with the Chinese people, I'd like to recognize a few individually for special merit. The first being Wei Wenliang. He's the ophthalmologist who was arrested and subject to police investigation for, quote, spreading rumors. Forced to issue a public apology, all for practicing good medicine and discussing the outbreak of coronavirus in the hospital with his colleagues and going above and beyond the call of duty. Unfortunately, he has died from coronavirus back in February. The second being Ai Fen, the head of ER medicine at Wuhan Central Hospital. She documented a case of COVID-19 early on in December and reported it to the relevant authorities. For her troubles, She was shamed for doing so and told to stay quiet. After an interview with Chinese media in March, where she didn't stay quiet but rather lamented about the mishandling of the outbreak by the Chinese authorities, she's gone missing. And Quen Qishi, a lawyer and journalist who live streamed from Wuhan's Central Hospital in an effort to document the story and share information with the public, has also gone missing. Not seen since February. Also, the Chinese American, Zeng, a professor at Stanford, wrote a book called The Institutional Logic of Governance in China, an Organizational Approach. This is back in 2017, but since gained some new popularity. The Guardian reports that in an interview translated into Chinese, but later blocked by Chinese social media, Zhu blamed the country's top-down decision-making. Quote, "This is not only an outbreak of novel virus, it's a manifestation of the breakdown of China's government structures." He said, "This crisis has exposed cracks in the system." So being Chinese doesn't mean unyielding loyalty to the CCP, Wu. So just saying that. Back to the resolution, though. The Wisconsin State Senate encourages the United States government to follow the WHO recommendations and work together with the WHO and other countries towards the goal of preventing the virus from taking more lives. Now, it's unclear whether the WHO is more concerned with saving lives or than being a model mouthpiece for the Chinese government. Considering that the U.S. president has now defunded the WHO pending an investigation, it raises some doubts, I'd say. So, how did it go? So there's the resolution. You can read all of it if you want in its entirety. I mean, I get it all, but I did insert some commentary. But how did it go? Did Wisconsin pass the resolution? Well, not exactly. Here's the proposed revision. March 26, 2020. Introduced by Senator Roth, referred to Committee on Senate Organization, relating to acknowledging that the Communist Party of China deliberately and intentionally misled the world on Wuhan coronavirus, and standing in solidarity with the Chinese people to condemn the actions of the Communist Party of China. Whereas the state of Wisconsin is currently in the state of emergency due to the rising spread of coronavirus, which is originated in the Wuhan province of China, as the number of infected individuals in Wisconsin rose to over 700 and also consisted of 8 deaths as of March 26th. Whereas the Chinese people are a great people and heirs to one of the greatest civilizations in history, held hostage by a brutal and oppressive regime these past 70 years. And whereas the Communist Party of China has engaged in a continued pattern of human and natural rights abuses perpetrated by the country's communist administration, including the Communist Party's treatment of Tibet, the internment and re-education of 1.5 million Muslim Uyghurs in concentration camps, the enactment of a one-child policy, responsible for aborting hundreds of millions of children, the majority of them female, a record of organ harvesting and forced sterilization, a crackdown on the Tiananmen protests, and restrictions on individual expression and religious practice. And whereas the Communist Party of China has repeatedly demonstrated a lack of interest in respecting international norms, including a history of currency manipulation, intellectual property theft, and restricting Chinese market access, while receiving the condemnation of numerous American presidents and legislators from both political parties. And whereas the Communist Party of China, led by President Xi Jinping, has moved to consolidate power, scrapping term limits to create a de facto life term for the president of China, and continually squashing democratic-based initiatives in and outside of mainland China. And whereas the Chinese government is currently engaging in a barrage of misinformation throughout all corners of the globe, attempting to pass off responsibility for the negligent and reckless response to the virus. And whereas the Chinese government has imprisoned their own citizens who dared disseminate accurate information on the coronavirus, destroyed early samples of the virus, refused to release timely and accurate information on the virus, and continued to allow infected individuals to leave Wuhan after reasonable evidence of person-to-person contamination was present. And whereas reports have indicated that had the Chinese government acted in a more efficient, transparent, and responsible way, many cases of the virus could have been eliminated by 95%. So whereas reports have indicated that had the Chinese government acted more efficiently, transparently, and more responsibly, cases of the worldwide virus could be reduced by 95%. Whereas February 25th, 2020, the first confirmed case of coronavirus was identified in Wisconsin. And whereas February 26th, and again on March 10th, the Chinese consulate reached out to the Wisconsin State Senate president, requesting that the Senate pass a resolution written by the Chinese consulate, including propaganda and falsehoods, such as, quote, China has been transparent and quick in sharing key information with the WHO and the international community, thus creating a window of opportunity for other countries to make a timely response. Whereas the Wisconsin State Senate deems it necessary and prudent to combat the spread of misinformation propagated by the CCP and the need to push back on claims that the virus originated anywhere other than China. Now, therefore, be it resolved by the Senate that the Wisconsin State Senate acknowledges that the CCP has deliberately and intentionally misled the world, suppressed vital information on the statistics and spread of Wuhan coronavirus both domestically and abroad, allowed millions of individuals to travel outside the province and country despite clear warnings that the virus would be transmitted from person to person, and engaged in active suppression and persecution of individuals looking truthfully to discuss information related to coronavirus, which has led to a global pandemic, the likes of which has not been seen for generations. And be it further resolved that the Wisconsin Senate hereby stands in solidarity with the Chinese people, condemning the acts of the CCP in the strongest possible terms, and acknowledges that millions, both in China and around the world, are at risk of illness and death due to the negligence and hostile actions of the CCP. End. So, good on you, Senator Roth, for your counterproposal. Currently, it's waiting for a vote. And because the legislature right now during this pandemic is only meeting for emergency bills, we're going to have to wait it out and see what happens and see if it's passed. Personally, I think it should pass. For Myth Informed, I'm Brian Edward. Thanks for listening.